Hello, Miss Abigail. My name is Nike, and I am a nurse practitioner student at South University. Today, I'm going to be doing an ed-to-toe assessment on you. Do you give consent?
Yes.
Okay. So prior to coming in, I've already washed my hands, but I'm just going to step over here and use some hand sanitizers. Okay. All right. Thank you so much for your patience. I just have a couple of questions I need to ask you before we proceed. Okay. Could you please tell me your name and your date of birth?
My name is Abigail. My date of birth is July 19, 1995.
Okay. Could you tell me today's date?
Today is Wednesday.
Okay, very good. And who's the president of the United States?
Donald Trump.
Awesome. Very good. So that tells me that your neurological senses are intact. Okay, you are completely alert and oriented. Okay. All right. So I'm just gonna step over here and get your vitals. All right. Do you give me permission to touch you?
Yes.
Okay. So your vitals. What I'm gonna be checking regarding that, I'm gonna check your blood pressure. I'm gonna check your pulse, which is also your heart rate. I'm gonna check your respirations, and I'm gonna check your oxygen today. Okay. All right. So before I proceed again, do you have any pain? Are you hurting anywhere at all?
No.
Okay. Very good. So I just want you to try and relax for me, okay, while I check your blood pressure. All right, very good. Your blood pressure is 118/64. This is normal. Thank you so much. Now I'm going to check your temperature. All right, this is going to go under your tongue for me. Hold that for me, please. Thank you. And I'm going to check your oxygen and your heart rate while we're doing that. And I'm also going to be checking your respirations at the same time. Okay, so your respirations is 18, your oxygen is 98, and your pulse is 76, which is also your heart rate. Your temperature is 98.3, so that's very good. Okay, so at this time, I'm just gonna take a general survey of your skin, and I'm looking at your skin. Your skin looks very good. I don't see any rashes, I don't see any bumps, I don't see any open areas, any drainage or discharge coming anywhere from your skin. Your skin appears very intact. You're well dressed, so that tells me that you've taken very good care of yourself over the years. I'm looking at your toenails, everything looks good. There's no deviations or nothing. Your head looks symmetrical. Okay, it's proportionate to your height and to your weight. Okay, all right. So I'm also looking at your head. I don't see any flaking. I don't see any bumps. I don't see any open areas. I don't see any tenderness in your head. Do you give me permission to touch your head?
Yes.
Okay, so at this point, I don't feel any bumps. I don't feel any flaking. Like I said, your hair distribution is normal to your head. Okay. Have you had any issues with your head at all?
No.
Okay, very good. All right, so now I'm just going to proceed to the eye portion of this examination, and I'm looking at your eyes. Your eyes are symmetrical. I don't see any nystagmus or double vision. I don't see any redness or conjunctivi or any exudate. Your sclera is red. Your sclera is white. I don't see any jaundice. So right now I'm just going to get my pen light, and I'm going to take a look inside your eyes, okay? So I just want you to look directly at me. Just look at my nose. All right, very good. So your eyes are reactive to light. All right, so I'm just gonna do a few tests, okay? I want you to just follow my pen light without moving your head. Just follow my pen light with your eyes only, okay? Very good. Very good. Okay. Very good. All right. So I just want you to tell me when you can see my hands, okay?
Okay.
Can you see it now?
Yes.
Okay. How about now?
Yes.
Okay. How about now?
Yes.
How about now?
Yes.
How about now?
Yes.
Okay, very good. So that tells me that your cranial nerves are intact, okay? Now I'm just gonna look inside your eyes one more time. I'm just gonna palpate your eyes. Any pain in your eyes?
No.
Okay, look up for me. All right, I don't see any conjunctivitis. I don't see any redness in your eyes. All right, close your eyes and try to open them. Okay, very good. All right, awesome. That's really good. Thank you so much. All right, so we're going to move to the ear portion of this examination. Okay, and I'm looking at your ears. They are symmetrical to your head. I don't see any redness. All right, your mastoid process looks to be intact. I don't see any edema or tenderness or swelling behind your ears, okay? Now I'm just gonna feel your ears behind your ear. Your auricle looks nice. Your ear canals look clean and well groomed, okay? So right now I'm just gonna step over here and get my otoscope and we're gonna take a look inside your ears, okay? Good. I'm gonna come over on this side. All right, very good. So your tympanic membranes are well, it's clear in there. I don't see any red reflexes. I don't see any swelling. Okay, it's pearly gray, the way it's supposed to be. Okay, all right, so right now we're going to move to the eye portion, to the nose portion of this examination. I'm looking at your nose look proportional to your face. I don't see any swelling, I don't see any septal deviation. It's symmetrical to your face. I don't see any swelling, any discharges that's coming from your nose. Do you have any issues with your sinuses?
No.
Okay, very good. So I'm just going to get my pen light and take a look inside your nose. If you just hold your head back for me. Very good. So the inside of your nose looks very good. It's clear. I don't see any redness, no swelling, no polyps that I can see, no abnormalities with your nose. Okay. All right. So right now I'm just gonna palpate your sinuses, and it's this area right here in between your forehead and your eyes. Okay. And let me know if you feel any tenderness, any pain on palpation. Okay.
Okay.
Any pain?
No.
Okay, all right. So your sinuses looks intact. There's no swelling, no nodules, no masses that I can feel. Okay, all right, very good. So right now we're gonna move to the mouth portion of this examination. So I'm looking at your lips. I don't see any cracking. I don't see any redness. I don't see any bumps on your lips. Okay, I'm just gonna get my pen light again, and I'm just gonna look inside your mouth. Just open your mouth real big for me. All right, very good. Can you say ah? Okay, very good. All right, so your uvula is straight. It's in the right position. I don't see any deviation with your uvula. Your mucous membranes look intact. It's moist. It's pink. Okay. All right. So right now I'm just gonna feel for your TMJ area. Any pain or tenderness in this area?
No.
Okay. Try to open your mouth for me. All right. Very good. And close it. All right. Okay. And I'm also gonna palpate for your lymph nodes. Do you have any trouble swallowing?
No.
Okay, can you try to swallow for me? All right, very good. Just checking your the back of your neck as well. All right, so the back of your neck looks very supple. I don't feel any tenderness. I don't feel any mass. It's symmetrical. Your trachea is midline where it's supposed to be. I don't see any deviations in your trachea, okay? So very good. All right, so we're gonna move over to the shoulder portion of this examination, okay? I'm just feeling your shoulders for any tenderness, any pain, and the bumps. All right, try to raise your shoulders up for me against resistance. Okay, very good, and let it back down. All right, very good. All right, can you squeeze my two fingers as hard as you can? Squeeze really hard. Okay, so your grips are equal on both sides. Right now, I'm just gonna feel your pulses. I'm gonna feel your radial pulse. Radial pulse on this side. And I'm gonna feel them against each other. Very good. And I'm gonna check your brachial pulses too. All right, very good. I'm just gonna feel your elbows. All right, can you bend your arm for me? Any pain with doing that?
No.
Okay, very good. And let's do this side as well. Bend your arm for me. Any pain with that?
No.
Okay, all right. Can you raise your arms up for me? All right, very good. Any pain with raising your arms? All right, try to put your arm down against my hand. Trying to push it down. Okay, very good. All right, that's good. All right, I just want you to do this motion with your wrists. All right, and back. All right, any pain? Now go side to side, go round. Any pain with doing that?
No.
Okay, very good. All right, I'm just gonna check your capillary refills, I'm sorry. Okay. All right, so you have really good capillary reflexes. It's 2+, okay? I'm sorry, 3+. All right, very good. Okay, so at this point, I need to, if I can get you to just move over to the bed and just take off your shirt for me, we're gonna move to the cardiac portion of this examination, okay?
Okay.
All right, if you just have a seat before laying down for me. Okay, very good. All right, so right now I'm just gonna take a quick listen to you, but before I do this, I'm just gonna take a look at your chest, and your chest looks symmetrical. Your breathing is symmetrical with your chest movements. I don't see any abnormalities at all or deformities in your chest. Okay. Don't lay down. Can you breathe for me? Just taking a deep breath and let it back down. Very good. All right, let me just take a look at the back of your chest. All right, so your AP proximeter is proportional, okay? Very good. So right now, I'm just gonna take a listen to you, okay? I'm gonna listen to your lung sounds first, and then I'm gonna listen to your heart sounds, and then I'm gonna touch your lungs and percuss your lungs, okay? I'm just gonna feel and make sure there are no abnormalities, okay? So just breathe normal for me. Now I'm gonna listen to your back, okay? All right, very good. So your lung sounds are normal. There are no diminished lung sounds or adventitious sounds that I could hear. I did not hear any crackles. I didn't hear any murmurs. I didn't hear any rhonchi in your lungs. So your lung sounds are very good. So right now, I'm just gonna listen to your heart sounds, okay? to listen to your aortic, your pulmonic, your tricuspid, your mitral, your Herb's point, and then your PMI. All right, so your lung sounds very good. I did hear S1 and S2. I did not hear any S3 or S4 sounds, which would indicate an abnormality. I did not hear any clicks, any murmurs, and there were no rubs that I heard, okay? So your lung sounds and your heart sounds are very good, okay? So at this point, I'm just gonna feel any pain on this side. Okay, if I can just get you to just lie down for me. I'm just gonna percuss your lungs, okay? And right here, I'm just feeling for any enlargements. All right, so your lung sounds good. I didn't feel any enlargements in your lungs, okay? All right, very good. So right now I'm gonna move to the abdominal section of this test. All right, so I'm just looking at your abdomen. I don't see any abnormal pulsations. I don't see any swelling. I don't see any any abnormalities at all, okay? And I don't feel any abnormal movements in your abdomen, okay? So the first thing I'm gonna do, I'm just gonna take a quick listen to your abdomen, and I'm gonna listen in all 4 quadrants. I'm gonna start with your right lower quadrant, and I would listen for 5 minutes in each quadrant. All right, so I'm gonna go ahead and listen to your vascular sounds, okay? I'm gonna listen to your renal arteries. And renal arteries on this side. I'm gonna listen to your aortic artery. All right, I'm gonna listen to your epigastric. Okay, your iliac crest. Iliac crest. And I'm gonna listen to your femoral arteries, okay? All right, very good. Could you please tell me the last time you had a bowel movement? This morning, okay. Any issues with moving your bowels at all? Any pain, any constipation?
No.
Okay, very good. Your bowel sounds really good. You do have active bowel sounds in all quads. Your renal artery and your vascular sounds are very normal. I did not hear any bruits. I didn't hear any murmurs, okay? Everything sounds okay. All right, so at this point, I'm just gonna percuss, and pretty much what I'm doing, I'm gonna percuss your liver and your spleen and also your pancreas, and I'm just trying to see if there's gonna be like any abnormalities or any swelling in those areas, okay? Okay, and I'm also gonna percuss in all 4 quadrants, okay? All right, so the percussion was good. I did not feel any swelling of your liver or your spleen. I didn't feel any hepatosplenomegaly. I didn't feel any of that. Your pancreas was not enlarged. It's not swollen or anything, okay? So it sounds good. So right now I'm just gonna feel around. I'm gonna start with your right lower quadrant. I'm gonna do like a rebound tenderness test on you, okay? Any pain?
No.
All right, so I'm doing a light palpation first. Let me know if you feel any pain.
No.
Okay, all right, so right now I'm gonna do a deep palpation, okay? Do a rebound tenderness. Any pain when I released?
No.
Okay. Okay. All right, very good. So the palpation was negative for rebound tenderness. It was also negative for Murphy's sign and arbiterator sign, okay? All right, very good. All right, so at this point, can I just get you to sit up for me? And just dangle your feet. All right, very good. So now we're gonna move over to the lower extremity portion of this examination, okay? So I'm looking at your feet, I'm looking at your legs. I don't see any swelling, no discoloration to your legs, okay? There are no bumps, there are no bruises. Your toenails look okay, it looks good. And I'm just gonna feel your legs, okay, for any swelling, all right?
Okay.
Any pain with me touching? Okay, any pain with me touching? Okay, all right, and I'm just gonna feel your pulses, okay? I'm gonna start with your popliteal. All right, your tibial pulses. Your dorsal. Okay, repeat the process on this side. Okay, and I'm gonna check the capillary refills on your toes. All right, so your pulses are equal, the rate and rhythm are normal, okay? There are no abnormalities that I can speak of. Your capillary reflexes, your capillary refills are good, okay? All right, so can I just get you to raise your legs up for me one at a time? We're just gonna check your strength, okay? Very good. And then on this side, okay, very good. Can I get you to just stand up for me? We're gonna check your strength and your muscular muscles, okay? All right. Can I just get you to walk towards me in a straight line? Very good. Now can you walk back for me? Okay, very good. Now I want you to walk towards me and walk toe to heel like this. All right, in a straight line. Very good. Very good. All right, thank you so much. Now I just want you to raise your leg up for me one at a time. Okay, and move it over to the side. Very good. All right, let's do that on this side and move it over. Okay, very good. When you came in to see me today, your balance looks okay. I did not see any deviation in your balance at all. Okay, all right. So I just want you to do a nose test for me, a nose touch, a touch to nose test, okay? So I want you to do this motion. One at a time, alternating. Do it again, one at a time. Okay, very good. All right, can you try to shrug your shoulders against my hand one more time? Okay, very good. Do you have any pain at all in your lower extremities? Anywhere? Okay, all right. So now I just want you to close your eyes and hold your hands out for me. Hold your arm out for me. Very good, in front of you. Okay, and we're gonna hold it there for like 5 seconds, okay?
Okay.
All right, very good. Any dizziness, any lightheadedness with that motion?
No.
Okay, very good. All right, can I just get you to have a seat for me? All right, so I want you to raise your legs up against my arm. Very good, and let it down. Okay, Raise your legs up. Now try to push it down. Okay, very good. How about on this side? Try to push it down. Okay, very good. All right, so that concludes our physical examination for today. Thank you so much for participating. I'm just gonna move over on this side and I'm gonna wash my hands again, okay?
Okay.
All right, Miss Abigail, thank you so much for participating. I really appreciate it. Do you have any questions for me?
No.
Okay, well, thank you so much. It was a pleasure.
Pleasure, ma'am.
All right, thank you.